First thing we're going to do is remove medication from a vial. Then we're going to give an IM injection or intramuscular. And then we're going to give a subcutaneous injection. Okay, so let's begin. First thing you want to do is verify your doctor's order. You go to your chart, you look at the physician order. We can see here that it says Demerol 25 milligrams IM every 4 hours as needed for pain from 5 to 9 on a 0 to 10 scale. Our patient currently has a pain scale of 7, so this would be an appropriate order. The next thing we do is check our chart for allergies. Allergies for our patient is penicillin and chocolate and pollen. So he has some environmental and is allergic to penicillin, which the order reads for Demerol, which is our narcotic or an opiate, completely 2 different classes. And then we were going to review the purpose of Demerol. Demerol is to control pain, usually the high side of pain, in that mild to moderate to high or severe pain, 8 to 10. Doctor order said from 5 to 9, so definitely we would want to give this Demerol, which would be appropriate for the patient. Side effects, respiratory, because it is an opioid, can reduce respiratory status. GI distress is another side effect that you would have to pay close attention to. Also, itching and hives for Demerol. Next, after verifying the allergies, you want to go ahead and read the MAR to make sure it is appropriate from the orders that you review. Demerol 25 milligrams IM every 4 hours is needed for pain from a 5 to a 9 on the pain scale. Compare the label. Here's my medication. It does say Demerol 50 milligrams per 1 ml. Expiration date reads November 30th of 2011, which it is appropriate to go ahead and use that. Also, calculate my medication dose. Since it is 15 milligrams in 1 ml, I'm going to go ahead and give 1/2 ml or 1/2 of an ml, which would be 1/2 of an ml in the syringe. So that is what I'm going to be drawing up. So I would gather my medication, my syringe and needle that I will draw up from the vial, plus the needle I will go ahead and give the medication with to my patient, my alcohol, my 2x2 gauze, and have a pen readily available to go ahead and document the MAR. On the MAR. Then I would go ahead and wash my hands to perform hand hygiene, come back, and I'm ready to begin. The procedure, we're going to go ahead and pop the top off of my vial, as so. Take a alcohol prep or your antimicrobial, give it a good wipe, and allow it to dry. Go ahead and remove my syringe, remove the cap from the needle. I'm going to be giving 1/2 of an ml, so I'm going to go ahead and pull my plunger down to the appropriate 1/2. Go ahead and hold. Also, I have my antimicrobial, which is already dried. I'm going to go ahead, insert my syringe, go ahead and plunge my air, turn the vial over, bring my bevel of my needle down, go ahead and draw up 1/2, go a little bit beyond, and go ahead and push the air bubble. Go up to the 1/2 ml, turn over the vial, and then go ahead and connect. There is a safety feature here on this needle. Since this was the needle that you drew up with, you're not going to go and give this to the patient. Plus, it's a larger gauge, or in some facilities, it would be a filter needle. So you go ahead and take your thumb and provide the safe lock so you or your patient does not get stuck. Then we want to go ahead and change our needle. So we keep this one clean. We go ahead and open our next needle, disconnecting this without contaminating. Go ahead and screw this on, and now you're ready to take this in to your patient's room, which we're right here anyway, and to give this to your patient. Please keep in mind you will discard this needle into the sharps container in the room. Then we have this drawn up. We check the amount of medication again, a prescribed dose. Yes, it's 1/2. Verifying it with your vial is 50 milligrams in 1 ml. That would be 25.5 of an ml. Then we would go ahead, perform hand hygiene again, and get ready to administer our IM injection. Alright, so now we are in the room. we're going to go ahead and make sure we gathered what we needed. We hand hygienes or use hand sanitation because it is in every room. Provide privacy for your patient. Then we go ahead and identify our patients because my medication is right within my sight on the bedside table or the med card that you brought in the room. You identify your patient. Hello, Miss Decubitus. 4/16/81. That's your date of birth. Is that correct? 4/16/81. Great. And then I look at the allergy band on the other hand, or sometimes they are placed on the same side. Penicillin, pollen, and chocolate. Is that your only allergies? Yes, that's your only allergies. Great. And what is your pain scale on a 0 from 10 scale? It is still a 7. Okay. And could you tell me where it is in your lower back? Okay. And could you describe the pain to me? Words. Aching, stabbing. Oh, it's shooting. Okay. Is it radiating somewhere? Going somewhere? No, it's primarily staying in your lower back. Okay. And then anything makes it worse, anything makes it better. Oh, walking makes it much worse. Okay. All right. So I'm going to go ahead and give you your Demerol for your pain. And I have it right here. And if the bed was not in working position for me, I would go ahead and raise the bed, lower the side rail, or that way you can get closer to your patient. Then we're going to identify the different landmarks. We have the ventral gluteal. What you do is put the base of your palm on the hip. Go ahead and make sure this is out of your way. Go ahead and spread your middle finger and index finger and shoot right between. Then you would go to your vastus lateralis, dividing into thirds of the thigh, horizontal. You would want to go into the middle outer third. So we're going to go ahead and put it right there. And then also you have the gluteus maximus. Please draw your attention to the paper on the wall. This is the butt. The gluteus maximus, each buttocks can be divided into what we call blessing the butt. Born and raised Catholic, that's what I usually say, blessing the butt. And then we go ahead and go to the upper right, outermost, and where the star is. You can do it on both sides of the butt. And then the star marks the spot, okay? So this is called blessing the butt. Then we also have the deltoid. To identify the deltoid, you feel where the deltoid muscle is, and you aim for right in the middle, okay? So let's go ahead and give our IM injection. So we would take our to the bedside. We will go ahead and put our gloves on. And make sure, please, that the gloves are appropriate size for your hand, because you don't want to use too big and or too small. And I wear small, so we have to make sure they slide right on. And these are clean, so we'll go ahead and begin. So what you will do then is you will, alright, so we've already divided horizontal and vertical. We're going to go ahead and give this here. So what we will do then, keep an eye on the price. We'll go ahead and stabilize our muscle. We're going to wipe once, or you can also go out and around and one easy quick swipe. We're going to go ahead and let it dry. Popping off our cap, waiting it for it to dry. The mannequins, it takes a little bit longer. And then what we're going to do is go ahead and dart it at a 90-degree angle. Take our non-dominant hand, hold, aspirate, no blood, give it 1 ml within 10 seconds. Go ahead and hold again the skin, pull out, go ahead and leave our needle, grab our 2x2 gauze, hold, but do not massage. When we are finished checking for blood, go ahead and grab all of your garbage. Go ahead and take that into the needle box or sharps container. Then you take your garbage, wrap it up in your glove, take this one off, wrap that one in your glove, and throw it away. Without leaving your patient's side, you would then go ahead and make sure that they're comfortable. Ask them if they need anything. Go ahead and raise the side rail. Lower the bed to the lowest position. Bed lowered and locked, call it within reach, and side rails up, ×2. Okay? Then let your patient know when you'll be back in about an hour or so. 30 minutes sooner, because since you did give something for pain, Joint Commission says you have to reassess in 30 minutes. So tell me you'll be back in 30 minutes to go ahead and let him or her rest, and that you'll be back in 30 minutes to check on his pain to see if that Demerol had worked. Now we're going to document the Demerol that we gave. Demerol 25 milligrams IM every 4 hours is needed for pain. The pain scale was a 7. And then where you put it. So you would say you put it in vascus lateralis right thigh, and the time in which you gave it, which was 2:30, which would be 14:30 in military time. Your initials, make sure your initials are appropriate here, along with the bottom of your MAR. So then you're undone with documentation. You have to do date, time, and initials, which you did. Evaluate the patient's response. You would write something in your patient's notes, pain med given per MD order, please see MAR, so that way they know to go back on the MAR to see exactly what you gave and where you gave it. And then you would say patient tolerated, patient was in pain after giving, what the site looked like in which you gave that medication, and then make sure you document the assessment of the site in which you gave. And then you always end your statement when you're charting with safety, that you lowered the bed, you had it in lowest position, you locked it, side rails up ×2, and definitely the collet within reach. Then in 30 minutes, you will come back and document again on your nurse's notes to verify what the pain scale is and if any other medication needs to be given due to pain. Now we're going to do sub-Q. We are going to remove our insulin from our vial, and then we're going to make sure we have an insulin syringe along with a 2x2, alcohol, our clean gloves, hand sanitizer, and then our chart to verify the order. So the first thing we're going to go ahead and do then is verify the MD order. We're going to go ahead and look under the chart for the physician's order. Oh look, it does say insulin, 10 units for blood sugars greater than 250. His blood sugar was 251, so definitely that would be appropriate. So we need to give 10 units of regular. So we want to go ahead and verify that that is on the MAR. Insulin, regular insulin, 10 units with meals for blood sugars over 250. Sure enough, it is over 250. Prior to giving the insulin, though, we want to make sure that the tray is on the way or within the patient's reach. So as we hear it coming down, oh look, dietary. So we can go ahead and give that insulin. First, we need to draw it up. So we've gathered all our equipment, we've checked the MAR, we need to check the expiration date. It does say July of 2012, so perfect. We are within normal for that expiration date. And then we would document the time and date that we opened it, which is July 14th of 2011, because it is a multi-vial dose. And then we would go ahead and gather our equipment, which we already have done, perform hand hygiene, and then go ahead and start drying it up. Go ahead and pop the top off of your insulin vial, because it's the first time we're using it. Go ahead and get your alcohol, one good swipe around, let that air dry, go ahead and open your insulin syringe. We want to give 10 units, so we're going to go ahead and draw up 10 units of air into the syringe, allowing that to dry. It is dry, so we go ahead, take our syringe, we put in it, holding the vial, plunging the air in, and turning over your insulin. Go ahead and draw it up. Pass the 10 to eliminate the bubbles. Do not tap, because with tapping in insulin, you go ahead and break up the molecules. 10 units. Then you want to do the scoop mechanism. Go ahead and once you have it covered, go ahead and cap. Also, most facilities now are doing insulin as a dual nurse check. So what you would do is grab your MAR, find a nurse that is working with you or around the corner, and have them verify that the order says on the MAR, the insulin, 10 units regular, blood sugar would also have to be documented, and then show them that the vial in which you pulled it up, along with your syringe, so they can verify that it was the right syringe, right amount, the right dose with the right blood sugar, and that has verification, so it's a dual nurse sign-off. Then you have that ready. You go ahead and grab your equipment. You will go ahead and grab your 2x2 gauze, your alcohol, your syringe, clean gloves. Go ahead and enter your patient's room, providing privacy. Come to your patient, identify your patient. Doc, this is D. Cubitus. She is 41681. Now, after you've had your Demerol, now you need some insulin because your blood sugar. Okay, so we have to give you insulin now. 10 units of regular, sub-Q in the belly or the arm. What would you prefer? You would prefer the belly? Okay. because most of the time we would save abdomens for the patients who are diabetics to go home with, because it is actually more access than they would be able to do the back of the arms. But she would prefer that we do the belly, and plus she doesn't have a lot of meat back here. So we're going to go ahead and give her sub-Q or subcutaneous injection in the belly, 10 units, because it's what the patient preferred. So we go ahead, and I already performed hand hygiene. I used the hand sanitizer as I entered the room. I go ahead and put on, again, my gloves that fit, because we would not want to give an injection with gloves that are too big and or too small. And so here we go. Go ahead and put our clean gloves on. We find our site, expose the skin. The idea with exposing the skin is you want to be able to grab and make sure you have all your equipment available there. Go ahead and open your alcohol prep first. Pinch the skin. Wipe with a clean sweep. Go ahead and let it dry. Undo your insulin syringe. Subcutaneous injections go 45 degrees or 90, and bevel up. Please remember bevel up. I'm going to go ahead and do it at a 45-degree angle. Bevel up, inject. Go ahead and put in the 10 units, pull out, grab my gauze, hold, do not massage again. Do not recap your needle at this point. Go ahead and hold. Cover your patient. Do not leave her. Go ahead and put your needles, your syringe in the sharps container. Again, folding your garbage in your gloves. Discarding the gloves. Last thing you will do is say, are you okay? Do you need anything? Go ahead and bed lowered and locked, because you did, if you needed to raise it, you could have for working height. Lowered and locked. Call light within reach, side rails up to 2, and just let your patient know that you will be back if they need to in an hour for potty pain and position. And then ask them if they need anything. While you're here, you can also ask how the pain level is doing, since you know you just gave them that Demerol about an hour ago. And so what is Miss Cubitus, how is your pain scale? On a 0 to 10, what is your pain level? Okay, it's a 2. Oh, it's getting better. All right, if you need anything, please, here's your call light. So call light's within reach, bed lowered and locked, side rails up to 2, call right within reach, and let your patient know you'll be back. Okay, so now it's time for documenting your subcutaneous injection with the insulin. So first we get our MAR, make sure it's, of course, the patient. All right, so we're going to go ahead and document. I see the insulin 10 units. You're going to document the blood sugar, which was already on there from earlier when you verified what you gave. And it was signed by the person who was the dual sign-off. Now it's your time to sign. Make sure the initials that you're matching is appropriate, the time that you gave it, which was appropriate, and the patient's response, how the site looked, and it's doing well. You go ahead and document that accordingly on the MAR.